Hey guys, Jimmy again. So today we're going to talk about trauma assessment. Okay, in the previous video we talked about the primary assessment, and up until this point, right, what we just did is we determined the priority transport and the patient's GCS. Now the trauma assessment video, we're going to break it up into two parts. The first part is just talking about like what we need to get, and then the second part we'll talk about the head to toe assessment with some pictures or some videos. Okay, so when we do our trauma assessment, the first thing we need to do is take our baseline vitals. Now, our baseline vitals, we have to take the patient's blood pressure, patient's heart rate or pulse rate, and the patient's respiratory rate. Then after that, we're going to go ahead and take our sample history. Now, when we're doing our sample history, if the patient's responsive, then we can go ahead and ask the patients. Now, if the patient's not responsive or the patient's unresponsive, we can go ahead and talk to like a historian, like a family member or a friend that's nearby, somebody that knows the patient. Okay, and after that, we're going to do what we call a head-to-toe assessment. With the head-to-toe assessment, we have to know what DCAP BTLS is. Okay, DCAP BTLS is basically what we're looking for when we're doing our head-to-toe assessment. DCAP BTLS, what it stands for is deformities, contusions, abrasions, penetrations, and punctures, burns, tenderness, laceration, and swelling. Okay.